What if I told you that something incredibly small, something you don't do before going to sleep, could be quietly harming your leg circulation every single night? And what's even more surprising is that most people are never warned about it. I'm Dr. Christina Serrati. I've spent years studying how circulation works inside the human body, especially in the legs. And after observing thousands of people over time, I can tell you this honestly: the discomfort, heaviness, swelling, and constant fatigue so many people feel in their legs is not something they simply have to live with. That belief that painful or swollen legs are just part of aging is one of the biggest myths in modern health. What frustrates me is this: many of the people I've worked with didn't need expensive treatments, complicated procedures, or prescription medications to feel better. Their bodies already had the ability to improve circulation naturally. They just weren't activating it. You see, circulation isn't just about blood moving, it's about oxygen, nutrients, and energy reaching your tissues. When that flow slows down, fluid begins to collect, muscles feel weak, and the legs start to feel heavy, tight, or sore. Over time, people lose energy, avoid movement, and assume decline is inevitable, but it isn't. I noticed something fascinating in my research. Individuals who supported circulation before sleep consistently experienced better outcomes. Less swelling, less discomfort, more energy during the day. And the improvements often happened faster than expected. At first, I was skeptical. How could something so simple make such a noticeable difference? So I did what I always do: I went back to the science. I reviewed circulation studies, vascular research, and long-standing natural practices. And suddenly, everything clicked. Your body repairs itself most efficiently at night. Blood flow patterns change. Muscles relax. The nervous system shifts into recovery mode. When circulation is gently supported during this window, the body responds remarkably well. I've seen people in their 70s, 80s, even 90s experience real improvements, not because of a miracle cure, but because they finally worked with their body instead of against it. And here's the most surprising part: the method costs almost nothing. Most people already have access to what they need. I end this video. I'm going to explain exactly what supports healthy leg circulation before bed, when to do it, and why it works. I'll walk you through the science in a way that's easy to understand. No medical jargon, no fear tactics. If your legs feel heavy, tired, or swollen, if walking feels harder than it used to, or if you've been told to simply accept it, I want you to stay with me, because once you understand how your body responds to the right signals at the right time, everything begins to change, sometimes sooner than you expect. This is where the real conversation starts. Now, I want you to pause for a moment and really think about your own legs. How long have they been bothering you? Was it just a few months ago? Or has it been years? Maybe you notice swelling around your ankles at the end of the day. Maybe your legs feel heavy, tight, or sore even after simple walking. Or maybe you wake up already feeling tired, before the day even begins. Most people tell me they assumed this was normal. They believed it was just aging, poor genetics, or something they had no control over. And I understand why. That's what they've been told for decades. But here's the truth I want you to hear clearly: your legs don't lose circulation overnight for no reason. It happens slowly, quietly, and often without warning signs that people recognize. When blood doesn't move efficiently through the legs, gravity works against you. Fluid settles downward. Oxygen delivery drops. Muscles don't get what they need. Over time, discomfort becomes routine, and routine becomes normal. But normal does not mean healthy. One of the most important discoveries in circulation research is this: your body is constantly trying to correct these problems on its own. It wants blood to flow properly. It wants fluid to move out of the tissues. It wants your muscles to stay active and strong. The issue isn't that your body has failed you. The issue is that it's missing the right signal. During the day, many people sit too long, move too little, and keep their muscles inactive. That weakens the natural pumping action in the legs that helps blood travel back to the heart. Over time, circulation slows, and symptoms begin. Nighttime, however, is different. At night, your nervous system shifts into repair mode. Inflammation lowers. Muscles soften. Blood vessels respond more easily to stimulation. This is why what you do before bed matters far more than people realize. I've observed this pattern repeatedly in my work. People who supported circulation at night saw faster improvements than those who tried random daytime solutions. Their swelling reduced more consistently. Their legs felt lighter. Their morning stiffness improved, and no, this isn't about intense exercise, painful treatments, or complicated routines. It's about gently reminding your body how circulation is supposed to work. Many people worry when they hear about new approaches. They think, what if it irritates my skin? Or, what if it interferes with my medication? Or, what if it makes things worse? Those concerns are valid, and they're exactly why this approach focuses on natural support, not forcing the body or overriding medical care. This is not a replacement for your doctor. It's a supportive habit that works alongside your body's own systems. You don't need special equipment. You don't need a prescription. You don't need hours of effort. You need the right support, at the right time. In the next part, I'm going to explain what specifically helps activate leg circulation before sleep, and why it's been overlooked for so long. Once you understand this, everything you've experienced with your legs will suddenly make sense. Before I tell you exactly what supports circulation so effectively at night, I need you to understand why so many people never hear about it in the first place. Most healthcare systems are built around treating symptoms after they become severe. Swelling becomes medication. Pain becomes another prescription. Weak circulation becomes something to monitor. Very little attention is given to simple, preventive actions people can do at home, especially when those actions don't generate profit, and that's unfortunate. Because circulation problems don't begin as emergencies. They begin as small signals the body sends quietly: cold feet, indentations from socks, tightness around the calves, a heavy feeling at the end of the day. These are early warnings, not signs of failure, but signs of imbalance. In my research, I kept seeing the same pattern. People who waited until symptoms were severe struggled much more to improve. But those who addressed circulation early, even gently, experienced faster, more lasting relief. One reason is something many people don't realize: blood vessels are responsive. They expand, contract, and adapt constantly. They react to temperature, movement, pressure, and sensory input through the skin. Your skin is not just a barrier, it's a communication system. When specific sensory signals reach the nervous system through the skin, blood vessels respond. Muscles soften. Fluid movement improves. This is especially powerful in the legs, where circulation must fight gravity all day long. At night, this responsiveness increases, your heart rate slows. Cortisol drops. Blood vessels become more receptive to gentle stimulation. That's why nighttime support can feel dramatically different than anything you've tried during the day. Another important factor is consistency. People often jump from solution to solution: a cream 1 week, a pill the next, a device after that. Nothing is done long enough, or correctly enough, for the body to respond, but when the same gentle signal is applied every night, something changes. The body begins to expect it. Circulation adapts. The nervous system reinforces the pattern. This is when swelling begins to reduce naturally. This is when heaviness starts to fade. This is when people say, "My legs feel lighter, and I don't know why." I've watched individuals who struggled for years suddenly notice improvement within days, not because their condition vanished overnight, but because their body finally received the message it needed. And no, this isn't painful. It doesn't burn. It doesn't force blood vessels open. It doesn't override medication or medical care. It supports what your body already wants to do. People often ask me, if this works so well, why haven't I heard about it before? The honest answer is simple: it's too basic, too affordable, too effective without dependency. In the next part, I'm going to explain what that nighttime signal is, and why it works so powerfully on leg circulation when used correctly. Once you hear it, you may be surprised by how familiar it actually is. Now let's talk about the signal itself, the one that makes such a noticeable difference in leg circulation when used before bed. This is where many people expect something complicated: a device, a machine, a treatment plan that costs hundreds of dollars. But the reality is far simpler. For centuries, certain natural compounds have been used to support blood flow, muscle relaxation, and fluid movement in the legs. Long before modern medicine existed, people relied on plants that worked with the body's systems instead of forcing change. Two of these have stood out repeatedly in circulation research. One supports healthy blood vessel tone. The other encourages warmth, movement, and muscle responsiveness. When used together, and applied correctly, they create a powerful, yet gentle signal to the nervous system that says, "Restore flow." I'm talking about cypress and rosemary. These aren't random choices. Cypress has long been associated with venous support and fluid balance. Rosemary is known for its ability to stimulate circulation and awaken sluggish tissues. Individually, they're helpful. Together, they're remarkably effective. Here's why this matters. Your legs rely on a delicate balance between blood vessels, muscles, and the nervous system. When that balance is off, circulation slows. Cypress supports the vessels themselves, helping them respond more efficiently. Rosemary encourages warmth and gentle activation, not stimulation in an aggressive way, but in a way the body recognizes as safe. When these oils are applied to the skin, they don't just sit on the surface. The skin absorbs small compounds that interact with sensory receptors. Those receptors send signals to the brain, and the brain responds by adjusting blood flow. This isn't guesswork, it's physiology, and timing is everything. Used before bed, when your body is already shifting into repair mode, these signals are amplified. Blood vessels respond more easily. Muscles relax instead of resisting. Fluid begins to move instead of pooling. Another important piece most people overlook is touch. Applying these oils involves gentle massage, and massage itself is a circulation tool. It activates the muscle pump in the legs, encouraging blood to move upward. Combined with the oils, the effect is significantly stronger than either approach alone. This is why people often say their legs feel lighter or less tight even within the first few days. Not because something artificial happened, but because circulation began working the way it was meant to. And no, you don't need large amounts. More is not better. A small amount, applied consistently, sends a clearer message to the body than anything excessive. In the next part, I'll walk you through exactly how to use this step by step, when to apply it, how much to use, and how to do it safely so your body gets the maximum benefit. This is where everything becomes very practical. Now let me show you exactly how to use this, step by step, in the safest and most effective way. This is not something you rush. It's not something you do randomly during the day. The timing and the method matter just as much as the ingredients themselves. First, choose the right moment. The best time is right before bed. This is when your body naturally shifts into healing mode. Your nervous system slows down, inflammation decreases, and circulation becomes more responsive. That's exactly the environment we want. Before applying anything, gently clean your legs. Warm water is ideal. You don't need special soaps or scrubs, just make sure your skin is clean and dry. This helps absorption and prevents irritation. Next, prepare the oils. You'll need cypress essential oil and rosemary essential oil. You don't need expensive brands or special blends. Simple, pure oils are enough. Place a small amount into your palm, just a few drops of each. You can use equal amounts, or slightly more cypress if your legs tend to swell more than they ache. Rub your palms together briefly to warm the oils. Now begin at your feet, using gentle pressure, massage upward, from your feet toward your calves, and then toward your thighs. This direction matters. You're guiding circulation back toward the heart, not pushing fluid downward. Use slow, circular movements. There should be no pain, no aggressive pressure. Think of this as a conversation with your body, not a command. 2 to 3 minutes per leg is enough. As you massage, pay attention to how your legs feel. Many people notice warmth almost immediately. That's a sign blood vessels are responding. Some notice relaxation. Others feel a lightness that wasn't there before. After massaging, let the oils absorb naturally. Do not wash them off. Put on loose clothing or simply go to bed and allow your body to do the rest. That's it. No devices. No pills. No complicated routines. Consistency is the most important factor. Do this every night, even if you don't notice immediate changes. Circulation improves through repetition, not force. Now let me explain what usually happens next. Some people feel subtle changes the very first morning, less tightness, less puffiness, or easier movement. Others notice improvement within 3 to 5 days. By the end of the first week, most people report lighter legs and reduced swelling. By week 2, changes become visible, and by week 3, many people tell me they feel like their legs have woken up again. In the next part, I'll explain what's happening inside your body during this process, and what to expect as circulation continues to improve over time. This is where patience turns into real results. At this point, it's important to understand what's actually changing inside your body as you continue this nightly routine. When people feel improvement, it can seem almost mysterious, but there is very real physiology behind it. During the first few days, the most noticeable change usually comes from reduced fluid buildup. When circulation improves, excess fluid that has been pooling in the lower legs begins to move out. This is why many people notice their ankles looking less swollen or their legs feeling less tight, especially in the morning. As the days go on, something deeper starts to happen. Your blood vessels begin responding more efficiently. They open and close with better timing. This improves oxygen delivery to tissues that may have been undersupplied for a long time. When muscles receive more oxygen, fatigue decreases. Pain signals quiet down. Movement feels easier. Another important change involves the muscles themselves. Your calf muscles act like pumps. Every time they contract, they help push blood upward against gravity. When circulation has been poor, these muscles often become sluggish. Gentle nightly stimulation helps reactivate this pump mechanism, without exercise, strain, or stress. That's why people often say they feel steadier on their feet or more confident walking after a couple of weeks. There's also a nervous system component many people overlook. The sensory signals from the oils and massage calm the nervous system. When the body is less stressed, blood flow improves naturally. Stress causes blood vessels to tighten. Relaxation allows them to open. This is especially important at night. Sleep quality often improves as circulation improves. People report fewer leg cramps, less restlessness, and deeper sleep. And better sleep further enhances healing, creating a positive cycle. Now, I want to be very clear about expectations. This is not an overnight miracle. It's a gradual restoration. Some people notice changes quickly. Others take longer. Especially if circulation issues have been present for many years. That doesn't mean it's not working. It means the body is rebuilding balance step by step. Consistency matters more than intensity. If you skip nights frequently, results slow down. But if you stay consistent, even with a small amount, improvement continues. I also want to address safety, because that's always a priority. If you have very sensitive skin, test the oils on a small area first. If you're taking medications that affect circulation, it's wise to inform your doctor about any new routine. Not because this replaces medical care, but because transparency is always best. And if you ever notice increased pain, redness, or sudden swelling, stop and seek medical advice. Natural support works best when combined with awareness and responsibility. In the final part, I'll summarize everything you need to remember. And explain how to turn this into a long-term habit that keeps your legs feeling strong, light, and supported for years to come. Now let's bring everything together. You don't need to remember complicated medical terms or long instructions. What matters is understanding the pattern, and committing to a simple habit that supports your body instead of fighting it. Healthy leg circulation depends on three things: responsive blood vessels, active muscles, and a calm nervous system. When even one of these is out of balance, discomfort begins. When all three are supported consistently, the body does what it was designed to do: restore flow. That's exactly what this nightly routine encourages. By applying cypress and rosemary essential oils before bed, you're sending a gentle but powerful message to your body. You're supporting blood vessel function. You're reactivating the natural muscle pump in your legs. And you're calming the nervous system at the exact time it's most receptive. This isn't about forcing change. It's about allowing recovery. Many people ask me when they should stop. The answer is simple: you don't stop when something is working. Once your legs feel better, this becomes maintenance, a way to protect circulation long term. Think of it like brushing your teeth. You don't stop once they're clean. You continue so problems don't return. I also want to remind you of something important. This routine doesn't replace medical care. If you have serious vascular conditions, blood clots, or unexplained symptoms, a doctor must always be involved. Natural support works best alongside proper medical oversight, but for everyday circulation challenges, swelling, heaviness, fatigue, stiffness, this approach has helped countless people feel stronger, lighter, and more confident in their bodies again. The most important step is the first one. Not tomorrow. Not next week. Tonight. Go get the oils. Set aside a few quiet minutes before bed. Massage gently. Be consistent. And then pay attention, not just to how your legs look, but to how they feel when you wake up, when you walk, and when you move through your day. Your body is always listening. You just needed to know what to say to it. I'm Dr. Christina Serrati, and I want you to remember this: discomfort is not something you have to accept. With the right support, your body can surprise you. Thank you for taking this time with me. Now go take care of your legs, they carry you through your life, and they deserve it.